Can you explain the rationale for the PORTEC-3 trial?
The PORTEC-3 trial was started because the minority of women with endometrial cancer who are at higher risk for distant metastasis and thus a reduced survival are only 15% of the complete group, and there were little data on the efficacy of chemotherapy to reduce distant metastasis and thus to improve survival. There were two studies directly comparing radiation alone versus chemotherapy alone, but they didn't show any survival benefit. And there was a phase 2 RTOG trial which showed that the combination of radiation plus chemo was promising. And there was a NSGO ARTC phase 3 trial that's showing that sequential chemotherapy and radiation had a improvement of progression-free survival, but it was only a trend for overall survival, and there were various chemotherapy schedules, various sequencing used, and there were no data on toxicity and quality of life. So we set out to compare a uniform schedule of radiation plus chemotherapy, starting both treatments early versus radiation alone for those women with high-risk endometrial cancer.
Can you summarize the most important results with respect to toxicity?
Yes, we only report toxicity at this point because the trial only closed in December 2013 at 686 patients. But the most important findings at this point is that the combination of chemotherapy and radiation significantly increases adverse events, and patient-reported outcomes show also that there is a clear impact on quality of life, but that both adverse events and quality of life improves over time. In 1 year and 2 years there are no significant difference in grade 3 toxicity anymore, and also the patient-reported outcomes improve, but especially neurologic symptoms remain in a subgroup of the patients.
And do you think that adjuvant chemotherapy and radiotherapy should be used in clinical practice for patients with high-risk endometrial cancer? And do the benefits outweigh the risks?
Well, that's the key question, which will remain until we have the final results of the PORTEC-3 trial. Because I don't know if you saw last year that the GOG 249, which was reported as GO this year, comparing in a little bit lower risk population chemotherapy in 3 cycles plus vaginal brachytherapy compared with pelvic external beam, and did not show any survival benefit of the chemotherapy schedule. So we still are not sure if chemotherapy really improves survival. So at this moment, I would say for patients with advanced stage disease, node-positive patients, it's certainly worthwhile to discuss with the patient the benefits and risks of chemotherapy. And we have now provided clear data on those risks, on the adverse events, and on the impact on quality of life to counsel patients. But at this point, I don't think it's yet time to say this is standard treatment. You may be aware that another trial, GOG 258, which compared the same schedule, chemotherapy and radiation, but compared it to chemotherapy alone, 6 cycles of carboplatin and paclitaxel, did also complete recruitment. They looked at more advanced stages, 3 and 4, and they are also expected next year or the year after to have their final results. So then at that point, we will have several trials and we will really know more about the risk-benefit ratio.